Hello viewers, can you see the storage at different level? Central cold room, EPI headquarter, the temperature is +2 degrees Celsius to +8 degrees Celsius. For oral polio vaccine, it is -15 to -25 and the duration 6 months. At district level, +2 degrees Celsius to +8 degrees Celsius. For oral polio vaccine, the same, -15 to -25. And the duration is less than the central one, that is 3 months. At Upazila level, +2 degrees Celsius to 8 degrees Celsius. And for oral polio vaccine, the same temperature here. Look at here, the same temperature. And the duration is 1 month. Now during transportation, cold box, +2 to +8, +2 to +8 for 4 days. And vaccine carrier, the same temperature up to 1 day. Oral polio vaccine is the most heat sensitive, so it requires more cold temperature than the other vaccines. Look at this is a vaccine vial monitor. এখানে একটা চিহ্ন দেখা যাচ্ছে যে একটা সার্কেলের মধ্যে যদি হোয়াইট একটা স্কোয়ার থাকে তো এটা হচ্ছে it will say it is good or you can use it. যদি এটা সার্কেলটা এরকম ব্লক হয়ে যায় বা হোয়াইট স্কোয়ার থেকে যদি এটা ডার্ক হয়ে যায় then it's seems that it is not good for use and this should not be used for vaccination purpose. Can you see it? These are the signs. Look at these two vaccines are good because there is a circle and there is a white square in between in the circle. Okay, there is another term, this is very much important. AEFI. What is this? Adverse events following immunization. And AEFI is any untoward medical occurrence which follows immunization and which does not necessarily have a causal relationship with the usage of the vaccine. These are some untoward medical occurrence. Vaccine দেওয়ার পরে কিছু occurrence হতে পারে যেটার সাথে vaccine usageর কোনো relation নাই। World Health Organization কিছু classify করেছে। Number 1, vaccine product related reaction হতে পারে। Number 2, vaccine quality defecটের কারণে হতে পারে। Immunization error related কোনো reaction হতে পারে। Immunization anxiety related কোনো reaction হতে পারে। Coincidental কোনো event হতে পারে। For example, vaccine product related reaction এর মধ্যে আছে extensive limb swelling, vaccine quality defect related এর মধ্যে আছে failure by the manufacturer to completely inactivate a lot of inactivated vaccines. Our immunization error related reaction এর মধ্যে transmission of infection by contaminated multi-dose vial, immunization anxiety related reaction এর মধ্যে vasovagal syncope হতে পারে, coincidental যেমন fever after vaccination হতে পারে। Now there is another chart which is also very important. Live vaccines and kill vaccines, very much important for MCQ parts. Live vaccines are BCG, MR, OPV, chickenpox, rota and oral typhoid, and kill ones are penta, then tetanus diphtheria, TD, IPV, influenza, rabies, PCV and hepatitis B. এই চার্টটা কিন্তু খুবই ইম্পর্টেন্ট ফর অ্যাডমিশন পারপাস। Now there are some new vaccines which are going to be introduced soon. HPV, human papillomavirus vaccine, TCV, typhoid conjugate vaccine, JE, Japanese encephalitis. Okay, my dear viewers, I hope you have a brief idea on immunization and schedule in EPI program for the admission purpose, and also a brief knowledge if you're in course right now. Thank you so much for patience hearing. Hope you will have a best exam in your admission. Thank you so much.